And please welcome Dr. Baldwyn Torto, who's a principal scientist, member of the Senior Management Committee of ICIPE in Kenya. Please, Professor, come. And also Marc Prikazsky, who's my... well, come here, it's fine. He's the CEO of SIVA. Please have a seat. You can welcome them. So you are both expert and specialist of Africa, we can say it, an expert. Let's start with Professor Torto. The needs in Africa are totally different. We were hearing now Professor Unger and Professor Flood. Do you have a comment on what you just heard?
Yeah, absolutely. First of all, I'd like to thank the organizers for inviting me. It's truly a pleasure to be here. And I do have a comment based on what we heard from the previous speakers, that the theme of this meeting, which is medicine and humanities, I think in the context of Africa, the humanity part is there. That component is there. But the medicine part is limited. First of all, because people don't have access to good health care. The number of people, the population of Africans that live in the rural areas, about 70%. And when we talk about health care, the closest healthcare center may be about 60 miles. Or perhaps 100 miles. So in the African context, what is important is prevention alongside treatment, but with a lot of emphasis on prevention, because the access is not there, and then secondly, it's very costly in terms of transportation, in terms of the cost to the family, whatever the disease is. So prevention is the key. And prevention requires that people have to be trained at a certain level, not necessarily at the PhD level, like me. That is important, but more importantly, the community, identifying people where we do have community health workers, because they are the first line of responders when people have problems. When a community health worker is identified, and it's from that community, people have a lot more confidence. That person can go door to door. At the same time, when there is a problem, the person can be approached with whatever the problem is. Now, if you look at the African situation, the problems are not, in terms of disease, are not too many. Most often is malaria. And malaria, a lot has been achieved in terms of bringing down the mortality, mortality due to malaria, in the sense that a One Health approach was taken, involving the entomologists who will be monitoring mosquito populations regularly, involving the clinicians, involving social scientists. So a lot has been achieved in terms of the distribution of bed nets, and then at the same time, early diagnosis of the disease and use of drug therapies. But now, what Africa is facing is emerging infectious diseases like dengue, Rift Valley fever, yellow fever. These are the ones that are emerging after malaria incidence actually has been brought down. And most of these diseases are of animal origin. And the typical rural African family doesn't only get involved in agriculture, they always have animals associated.
They sleep with the animals.
Yeah, and then the young ones in some communities, they sleep in the same house as the young animals. And so when we put the patient or that family as the center of their health care, it requires understanding the cultural beliefs of these people. For example, why would they sleep in the same house with their young animals? Because they value them a lot. That is their bank account. And yeah, that is their bank account, just like the way we protect our bank account and keep them in the banks or we have them in safes. So they sleep in the same house with the animals because they have to protect the young ones, when you talk about a rural community, from hyenas, from wildlife. Apart from that, they have to worry about the bigger animals lying over the young ones. And if that is their bank account, it means that needs to be protected. The second thing, the third thing is that milk is an essential commodity within the family. That is the lifeline of the family. That's what provides them with their source of energy. And they have to milk the animals very early in the morning. And if they don't separate the young ones from the large ones, there'll be no milk available because the young ones will be feeding all the night. So they separate them and sleep with them in the houses so that they can milk the animals early in the morning so they can also have some food. Now, that exposes them to a lot of zoonotic diseases. So when we talk about bringing that family or patient as the center of healthcare, it means that you have to have somebody from that community who can actually train them to change their behavior. And that person also needs to be trained to be able to convey that message. So the One Health approach, I'll give you an example. For instance, late last year, El Nino was predicted in Kenya. And there was going to be an incidence of very outbreak of Rift Valley fever. Now, the climatic features which are used in predicting this disease can only be used like 4 months ahead of time. But what Kenya did is that they've set up a zoonotic diseases unit which involved entomologists, arbovirologists, the veterinary health people, the medical health people. They also have social scientists. So what they did was to go out early when that prediction was made to have mass vaccination. They also had the local community reporting to the health officials as well as the other components of the zoonotic decree about mosquito populations either building up so that the health officials were also looking at infections. Now, they do have some misdiagnosis because, like I said, healthcare is very limited. So some misdiagnoses occur where virtually all fevers are diagnosed as malaria. But guess what? There was no outbreak of Rift Valley fever because of the preparedness. So like I said, for families in the African context, it's about prevention and preparedness rather than the kind of care we have in the developed world where it's about high technology and then you have a doctor-patient direct contact. We don't have that. Prevention is more important to us. And it doesn't really cost much. And if we look at it from the global perspective, if we can prevent some of these zoonotic diseases within where you do have outbreaks, like in Africa, and consider the fact that these days we're talking about a global village and people travel a lot. When we can prevent such diseases within the African context, when people travel from Africa or visit Africa and then come to Europe, where with global warming, some of these diseases are also occurring, like chikungunya and so on, which occurred in Italy and so on. If we can prevent these diseases within the African context, I don't think we have to worry about it in the Western world.
Thank you, Professor. Maybe Mr. Mahieu, you want to add something about what?
I share 100% your point of view. I think that we have to protect animals to protect human beings. And also the fact that when you protect Africa, you protect Europe. That's something, it's obvious, it's the same systemic approach. And also you realize the importance of preventive medicine. Diagnostic and vaccines are crucial for both human and veterinary medicine.
Talking about veterinary, maybe Marc, Prikazsky, you've been many times to Africa, to Kenya, to Uganda. You share the experience of Professor Torto and what Mr. Mahieu just said.
Yes, absolutely clear. When we go in the field, we see how it's easy when we put things together means our industry, the animal health industry, the human people, people being in the field, strong government. If you want to eradicate a disease, it's what you need, and it works. And it works perfectly. And I can tell you a story about how we manage in Uganda, in part of Uganda, the sleeping sickness disease, having a specific program on the reservoir, which are cattle, and doing that, we avoid transmission through biting tsetse fly of the trips to human. And we saw on the curves on human cases that it was declining. And as we did it with a vet school, it worked perfectly. It's now part of the cursus, and every year we have, during 6 weeks, the guys going to the community to treat roughly 200,000 cattle to avoid the disease to spread all over the country. And doing that, now we have plenty of vets which are no more in the administration. They are moving to the private sector, and we have built a model which is sustainable. So it works perfectly. And our industry, which is a very small one, it's few percent, very few of the human industry can play a major role. I think the first one is about feeding the population. Just to give you some values, you have roughly 800 million people underfeeded on our planet, 100 million children, and you have 3 to 4 million very young children dying due to that. And we know that the demand will increase drastically. You all know that the demand in calories should increase by 50 to 60% all over the world. The demand in proteins, animal proteins, that is milk, eggs, meat, will increase drastically. And without our industry, it's quite impossible to fix it. Because looking on that, looking on the fact that we waste 30% of the feed worldwide, which is just a shame. Nevertheless, looking on the animal health diseases, if we can fix it, we can increase the productivity by 20%. Only doing that, with vaccines, with prevention, all over the different territories, not only in Africa, we are able to eradicate some diseases, like we did in France, in the US, or in Turkey, in different countries. And the second part, and you spoke about it, it's about zoonotic diseases. We all know that most of the emerging infectious diseases are coming from animals. The difficulty is that it can come through the domestic animals, but when it comes directly from wild animals to human, it's extremely difficult to fix it. It was a case with Ebola, because you need to have a vaccine to vaccinate the animal, but you need to find a way to vaccinate them properly. And we were able to manage it when it was a rabies disease, because we could vaccinate fox orally, but for other diseases, it's quite impossible. And so one of our main objectives, and I think our industry and CIVA as a company, is to try to tackle and to focus on specific diseases. We know how to do it. It's a question of investment, it's a question of education, because you need to have people in the field able to manage it. And it's not always easy, because you have, for cultural reasons, people don't want to move. For example, when you look on the avian flu disease, we had 10 years ago, killing roughly 2 million people. What we have seen is that, and it was quite strange in some places, mainly very young children were dying. And it was mainly due to the fact that the young children were sleeping with the birds just to have a look if the birds were not stolen during the night. Simply that. And so what is quite easy now to do is to vaccinate. After you have to go through laws, because it's quite difficult to convince that if you vaccinate, you have a risk that you will not know about the disease, which is not really true now, because you have a DIVA kind of vaccination program, and you can really know. It's mainly a question of confidence. Confidence in the different government to really be able to declare the diseases when it happens in some territories. It's absolutely possible to control it. And controlling, for example, the avian flu problems in the field will limit the risk. It's just a question of probability of having a high pathogenic virus on human. due to the fact that you have more risk of mutation, more risk of gene change from one virus to the other one, and having a virus which will be highly pathogenic on human and from human to other human. And it happened, and it can happen again.
But to manage all these with the virus, the key is, like what Alain-Marie was saying before, is the innovation?
Yes.
Because
yes.
you talk about, Professor, the prevention, but it's also maybe the innovation. In your, in SIVA, what are you doing?
But we have many projects. I just would like to give you an example on avian flu. You know that when you have a backyard bird or bird outside, you increase drastically the risk of having one infection because it's coming from palmipeds, which are wild animals. So classically, you increase the chance, and in some countries, like in Thailand, to protect the more industrialized production, and where it's more protected because it's inside a building, they have decided to destroy all the backyard, which has a social impact, you can imagine. There is another way, is to give a day-old chicken, which are already vaccinated, to the farmers. And we are doing that. We have a program with Bill and Melinda Gates Foundation. We are testing it in Africa. And if it works, we will be able to maintain the local production, the backyard production, and in the same time to be able to build a more industrialized production. And both are needed. We really support the fact that we don't have one kind of agriculture. We need all the different kind of agriculture like you have in Asia, in Africa, and even in France.
But Professor, will the farmers in Africa accept to vaccine their animals?
Absolutely. I mean, the lifeline is actually dependent on the animals. I didn't want to show slides, but I can give you an example that after educating communities in northeastern Kenya, where there's a huge trade of animals between Ethiopia, Kenya, Djibouti, and Somalia, after educating them about the disease Rift Valley fever and the fact that donkeys are alternate hosts to the virus, not necessarily just cow or sheep or goat, but donkeys. Donkeys mean a lot to the communities. They are the ones that, for transportation of water, transportation of the sick, transportation of, farm produce. So when they have old bed nets, old insecticide-treated bed nets, when they get new ones, they actually cover their donkeys at night with the bed nets so they are not bitten by mosquitoes. So that's that kind of innovation, even at the community level, to prevent the disease. So yes, absolutely, they will accept vaccination of the animals. And that is the reason why the Rift Valley fever outbreak did not occur, even though it was predicted, because the animals mean so much to them that if you can simply convince them and overcome the cultural beliefs, you can always introduce new technology, within that community. I just wanted to say that the innovation aspect is crucial to preventing these diseases. I mean, vaccination or development of vaccines. But the One Health approach always needs to be used because people who are in the development of vaccines have to be working with the people who are doing vector biology. I mean, most of the viruses are carried by insects, mosquitoes, sandflies, and so on. So if you work in isolation without working with the people who are trapping mosquitoes and learning more about mosquito behavior and what populations are occurring and so on, and also at the same time, people who are in bioinformatics. This is really very crucial. So we cannot continue working in isolation. We have to adopt the One Health approach because it works and it's been really very successful.
Thank you, Professor. Thank you, Marc, also.